Osteoporosis is a critical issue in women's health, especially in peri and postmenopause. Like many diseases, when we're talking about prevention, we have a lot more options and we like those options a lot more. Once we are dealing with disease management, we have less options overall, and we are going to like those options a lot less overall. And osteoporosis is a perfect example of that. While if we're dealing with the prevention of osteoporosis, we've got great options around making sure that we are exercising appropriately, making sure we're doing some resistance training, maybe some impact kinds of activities, as long as you don't have an injury or some issue that prevents you from doing that. Dietary interventions, like making sure you have enough calcium in your diet, making sure your vitamin D levels are optimal, making sure you're adding some K2 to that vitamin D. Those are really important pieces. However, those things are not going to treat osteoporosis once you have it. And I have seen so many women who get into their 60s, 70s, and they're suddenly diagnosed with osteoporosis, primarily because the first time we're screening women is at 65 years old, unless they have risk factor that means that we would screen them early. So they're not finding out often until they already have osteoporosis, in which case those dietary and exercise pieces are an important piece of the puzzle, but they are not going to treat osteoporosis in and of themselves. You're going to be faced with the decision of facing a future fracture and potential decline. Like, for example, a study showed that women aged 82, if they experienced a fracture in their femur, had a 25% risk of death within 1 year, because it just leads to such a rapid decline in that kind of age and time in our lives. And once you have it, it is so hard to backpedal, and we're screening so late. So the only solutions at that point are bisphosphonate medications. And I'm not anti-bisphosphonate. That is a really great option if you have nothing else, but they do have potential side effects. And most people don't really want to go on a bisphosphonate. I totally understand, but if you didn't do the work early enough to prevent osteoporosis, that's the decision you're going to be facing. And I've seen so many women who are thinking that they've done enough. They have led a relatively active lifestyle. They eat a relatively healthy diet, and they're just dumbfounded when they find out they have osteoporosis, and they want to know how to treat it naturally. And so my hope for you is that you recognize early on that you need to prevent osteoporosis. A majority of our bone loss that we will incur in the second half of our lives starts right in perimenopause, and a bulk of it happens in that perimenopause, early menopause transition. You will continue to lose bone, but a significant portion is lost early on. So beyond just diet and exercise and those things I just mentioned, hormone replacement therapy, if you're a candidate, is a really viable option. Both estradiol and testosterone, but primarily estradiol, has a significant impact and is FDA approved for the prevention of osteoporosis. It's not as good at reversing osteoporosis once it's there, but it can prevent osteoporosis. So starting on hormone replacement therapy, if you're going to do that in your perimenopausal transition, and stay on it for as long as you can, and you're a candidate and it stays healthy for you. That's a conversation you'll have to have with your doctor as whether or not it stays appropriate for you or not. But if you can help your body maintain bone through the use of estradiol in a balanced way with testosterone and or progesterone or whatever else you need for your support, can be a really useful, viable option that has a lot of other benefits as well. So I think one important thing to just mention here is, because we have a sweet window for starting hormone replacement therapy, meaning there is a window in which it has a much greater likelihood of a safety margin that is within 10 years of menopause or younger than 60. If you started menopause at 55, you don't have to be on hormones by 60, but you need to be on them within 10 years. If you went through menopause early, then you could start them as late as 60. That is to minimize some of the risks of starting those hormones kind of on the far out end of all of this. So if we're not looking for osteoporosis until 65, you need to be proactive. You need to either be asking for a bone density scan early so that you can assess for that when you're still in the window where it is appropriate and safe for you to start hormone replacement therapy without any increased risk of some of those side effects or negative effects from starting outside of that window, or you just need to start it as a preventative. And it is also useful if you have some other symptoms like hot flashes, but you don't have to have any other symptoms. If you just want to prevent osteoporosis, it is a viable option. So I hope this helps clear some things up around osteoporosis.